Do you have a gap between your front teeth? Here's how we close the gap in 4 steps. First, what is a diastema? A diastema is simply a space between two teeth, most commonly between the upper front teeth. Some people like it, but if it's changing over time or it bothers you, it can be treated safely after we know the real cause. So, what causes the gap? Here are the common ones. 1. Size mismatch. Sometimes the teeth are a bit smaller or the jaw is wider, so spaces appear. 2. Angulation. Even if the teeth are normal size, if they tilt outward, the gap looks bigger. 3. Frenum. A thick or low frenum, which is the tissue between the lip and the gum, can pull the gum area and keep the space open. 4. Gums and bone. Gum problems, bone loss, or inflammation can create spacing that wasn't there before. That's why we don't jump to closing it immediately. First, we diagnose. Here are the 4 steps we follow to close the gap the right way. Step 1. Panoramic X-ray. We check the roots, bone level, and make sure there are no hidden problems, like impacted teeth, missing teeth, extra teeth, or pathology. Because if the bone support is weak or there is an underlying issue, closing the space without planning can lead to relapse or gum problems. Step 2. Clinical examination. We look at the bite, how the upper and the lower teeth contact. We also ask about habits that can push teeth forward and reopen spaces, like tongue thrusting, lip habits, or nail biting. If the cause is a habit or an unstable bite, we must address it. Otherwise, the gap can come back again. Step 3. Gum and periodontal evaluation, plus a frenum check. Healthy gums are the foundation. If there is inflammation, buckets, or bone loss, we treat that first. And if the frenum is strong and inserted too low, it may need management, sometimes after orthodontic closure, to reduce the chance of relapse. Step 4. Orthodontic closure using laceback and light force. The key is gentle, controlled movement, so we close the space while keeping the roots parallel and the gums healthy. Light forces reduce unwanted tipping, help stability, and give a cleaner final result. Now, when do we need other options? If the gap is mainly from tooth size issues, or the shape of the front teeth makes the space look larger, orthodontics alone may close the gap, but the smile still looks uneven. In these cases, we can combine orthodontics with composite bonding, which is a conservative option to reshape and fill small spaces, or veneers for larger shape corrections or cosmetic goals after proper evaluation. The best plan is always based on the cause and the final smile design. Retention is non-negotiable. After the space is closed, we need retainers. Often a fixed retainer behind the front teeth, sometimes combined with a removable retainer, because the gaps have a high tendency to relapse. And that's it. Space closed, stable, and healthy. Thanks for watching. If you found this helpful, subscribe for more orthodontic tips.